Dr. Mahmoud Bozo. He's General Secretary of the Syrian Society of Pediatric Gastroenterology and the head of the Syrian Board of Pediatric Gastroenterology. Please, the floor is yours.
Yes, good afternoon, everybody. Good afternoon, Mrs. Chairman. I think in these 10 minutes, I will present to you a brief of our study about the Encopresis in a Syrian pediatric population for 10 years experience. I think all of us affronted this problem and are following somehow cases of Encopresis. And we know that, in fact, the published studies in Arab countries are limited in this domain. In fact, in my review, I didn't find Arab studies about the Encopresis in children in childhood in the region. So we know that Encopresis is defined as the repeated passing of stool. It arrives after years old, and the majority of cases are combined with chronic constipation, and the estimated prevalence in Western countries is around 1 to 7% following the different studies. It is more common in younger children. For example, the prevalence is increasing to 4% if the children is between 5 to 6 years old, and it is only 1.6% if he is 11 to 12 years old. The majority of cases are seeking medical care at age of 7 to 8 years old. To consider that chronic constipation is the cause of the Encopresis, we have to realize two of the following criteria, which are accorded by the Rome criteria, as we know all. Fewer than 3 spontaneous bowel movements per week, straining, hard stool, sensation of anorectal obstruction, sensation of incomplete defecation, and manual maneuvering for more than 25% of the defecation. For the management of the cases of the Encopresis, we are following this protocol. At first, we are putting a medical therapy by lactulose. We are send the child to the dietitian to prescribe a higher fiber diet. And during 6 months, we are following the children at least 3 times. It could be more, but at least 3 times. And the outcome of the treatment could be variable from the cure rate to the improvement to the non-cure rate. The objectives of our study is to identify the etiology of the Encopresis in a Syrian population, describe the appropriate evaluation of Encopresis in children, outline the management options available for the Encopresis. This is a retrospective review of the children which consulted the pediatric gastroenterology and nutrition consultation in Damascus, aged from 5 to 17 years old, from 1st of January 2020 till the 1st of January of June 2020. So 10 years of experience from 2010 to 2020. The results. The total number of children was 120. The majority of them, 68%, were boys. And 60% of children were sent directly and referred directly by pediatrician. The minimal age was 5 years old and the maximum was 17. The mean and the median was 7 years. The majority, so 99% of cases, as you see here, consulted us before the age of 12 years old, so between 5 to 12 years old. The mean duration of the symptoms before the first consultation was around 5 years. And as you see here, 73% of cases are consulting before the 12 months of the appearance of the symptoms. 105 cases, so 87%, were accompanied with chronic constipation, and 15 others are not accompanied with chronic constipation, so it is due to other causes. As we see here, psychological problems, surgical problems, and mental retardation, etc. Of 73 patients followed of the treatment, 61% followed the treatment. So there is a problem, as usual, for chronic constipation and encopresis. There is the problem of the dropped out. Around 40% are dropping out of the treatment and the protocol. And it is usual in case of the follow-up of the chronic constipation and the encopresis. For the number of consultations during the treatment, it is variable between 1 to 10. The majority of them consulted us between 3 to 5 times during the follow-up. Of 73 patients, 33 patients were totally cured. So the percentage of the cure rate was 45%. And 24 patients were improved. So 32.8% improving. And non-cure rate was 22%. So a total positive result could be considered around 80%. For the non-cured cases, they were all secondary to surgical interventions. The number was 5. Some psychological problems, and non-compliance with the treatment. The total number of the non-compliance with the treatment was 10%, so 7 cases. In comparison with other international studies, we found that the encopresis is more frequent in males than in females. In our study, it is correlated with the chronic constipation in the majority of cases, as it is in the international literature. The mean age in our study is around 7 years old, which is according to the international literature. And in our study, the mean duration of the symptoms before the first consultation was around 5 years, and the dropout is frequent, around 40% of the total number of the included patients. And 33 patients, so 45%, were cured, and the amelioration, the improvement was realized in 32.8%. A total positive number, the percentage was around 80%. As conclusion, the fecal encopresis is a frequent problem in children that requires effective therapeutic intervention. Most cases are caused by accompanying chronic constipation. The results of our study seems to be consistent with the results of similar international studies, and we need to enhance this experience and improve the effectiveness of the management. This study was accepted to be published, and it will be published soon. Thanks for your listening and ready for your questions.